It's time for Dr. Rademaker's prescription for transformation. Let's tap into your own authentic genius and live the life you desire.
You are now listening to
Join Dr. Rademaker for an enlightened conversation about our brain intelligence, our body intelligence, and our energy intelligence. And now, here's your host, Dr. Bart Rademaker.
Well, I'm Dr. Bart Rademaker, and this is Prescription for Your Transformation. Real people, real conversations, and real success. And I'm just double checking to make sure everything's set up. This is the first time that I've actually scheduled it in advance. So I'm hoping it's working. Just bear with me for a second as I check all these different monitors and make sure I'm live, because if I'm not, I'm just going to have to reset some things. And it looks good. Awesome. All right, so today, here's the title. The coronavirus. I mean, there's so much panic about this nowadays. It's kind of scary. And as I was joking with a friend of mine, it's going viral. All right, I just had to get that out there. So a little bit of tongue-in-cheek here, because we actually do have to downplay the seriousness of this. Yes, any kind of medical disease or condition can be very serious, and so it's really important for all of us to take the appropriate measures. But the problem is, with all this anxiety, this fear, and I had a great call today with my dear friend Chad Cooper and his program, Create Your Own Legendary Lifestyle. Just a great coach, great human being, a humanitarian, really helping people. And we were discussing, this whole idea of fear. Where is it really coming from? And I actually told him, I says, look, the problem with all this is lack of clarity. People just don't understand what's really going on. And in that space, in that place where they don't understand what's really going on, they're going to make all these assumptions. Unfortunately, a lot of people don't go that extra step to find out what's really happening. And besides the fact, so indeed, I had the challenge myself to figure out, all right, what's really going on here? As educated as I am, being 17 years in training and then 20 years in practice, being a scientist at heart as well as an artist, I still had a hard time navigating through all the information. So that's, one of the things that I want to share with you today. Just to share with you the facts, the statistics, the science, and what policies are putting together right now in the coronavirus, so that you can have that information firsthand. I'll be sharing a bunch of links, after this show, so that you can verify that information for yourself. This is still evolving in a very dynamic situation, and so some of this information, may be old by the time I air this or I share with you, and by tomorrow it's going to be a different statistic. But my job is, hopefully with full integrity, is to tell you what I've discovered so far, and then you can double check some of that stuff through the links. First and foremost, just chill out, relax. I'm going to share some information that's going to be extremely insightful, and that is also going to help you navigate this space with confidence and with a feeling that you're going to be okay, because guess what? You will. The other part, which is really fascinating for me, and for those who are not familiar with my history here, being a plastic and reconstructive surgeon for the last 20 years, but also very active in the regenerative space. Call it functional medicine, if you will, or integrated medicine, or regenerative medicine. There are kind of different disciplines in a sense, but I've encompassed all of that for the last 20 years, because my vision had always been, and it's fortunate that I've had this training over the years in 2 different continents and some of the best institutions in the world, where I'm looking at the human body as an opportunity to tap into that intelligence. And that's why my show is called Prescription for Your Transformation. Tap into your authentic genius, but also tap into your brain, your body, and your energy intelligence. And your body intelligence is phenomenal. Talked to Deepak Chopra once, and he shared, how the most intelligent pharmacy, the most capable pharmacy on the planet, is the one in your own body. And so we have to tap into that. And so part of what I'm going to share with you today is the potential of what regenerative medicine can do for you. I've been in that space for the last 10 years. It made sense to me because for me, my focus has always been how do we tap into the potential of the body to restore form and function. I know it's a mouthful, but let's go into the coronavirus first, and then I'm going to tap into the regenerative medicine because that's super exciting. And in fact, there's studies out there that are helping people or actually evaluating, how regenerative medicine can actually help, with patients with coronavirus. And in fact, there's a report which I'm going to share with you. Again, I'm going to give you all these links, where they took care of a critically ill patient in China, in Wuhan, and now she's doing remarkably well by getting mesenchymal stromal cells, or MSC cells. And so it's super exciting to be able to share that information with you. I'm going to make one disclaimer right now. I'm not making any claims on regenerative medicine specifically. I'm going to refer to reports and peer-reviewed clinical papers. And again, I'll list those, and I'm only regurgitating what other people are saying. But first and foremost, H1N1 virus. That was the pandemic in 2009. It's important to look at historically what's been happening so we can put this one in perspective. A lot of people were complaining, there I go, coughing, right? It's a dry cough. It's one of those symptoms of the coronavirus. I'm telling you right now, I don't have it. I don't have fever, and I'm going to share with you in a moment why I can tell you that. But back in 2009, 2010, there was a lot of fear-mongering there at that time. People were complaining that the CDC was inadequate in either providing information and doing a lot of fear-mongering. Well, guess they're not doing that now, but somebody else will. We'll talk a little bit about that as well. So what happened then, in the United States, we had perhaps about 40 million people infected with that. It was a new variant of the influenza virus, and it actually started in Veracruz, Mexico. That's where they isolated the first child, actually, just outside of Veracruz. And then the first child that was identified that had it was actually in California. So California bear the brunt of the beginning of H1N1. But what was interesting about that is that whilst 40 million people were infected, this is the facts, that approximately, potentially about 61,000 people died because of it. Now, 40 million people got infected that we know of, or predictably that we know of, and 61,000. So where are we at right now with this one in the United States? I think last count I checked was 11. It's probably more than that. I'm going to talk a little bit about what the risk is. Now, with the Spanish flu, which was in 1918, the numbers are dramatically different. And did a lot of research, and so bear with me. I'm going to have to check my papers here. But 11 to 21% of the world was infected at that time. But interesting enough, there were about 500,000 or close to 600,000 fatalities at that time. In the U.S., no, I don't know the numbers in the U.S. going back to 2009. So what's important here is that with the one in 2009 and looking towards what actually happened in 2017 from the influenza virus, there are large numbers of people that have perished because of that. And you know what? I have to make one correction. In 89.3 million people were infected in 2009 with the H1N1. There were 400,000. I mean, I don't remember anything about 2017 and how many people died then, but approximately 61,000 people died. So let's go ahead and put this whole thing in perspective. Yes, it's the coronavirus. It's the common cold virus. It's a variant of that virus, similar to the SARS, which is the severe acute respiratory syndrome, and the MERS, which is the Mediterranean version. And what's interesting about those is that those definitely affected the lungs. There's potential, with kidney failure, and those were really well contained and didn't continue. So this is the COVID-19 is a new variant. similar to the influenza virus H1N1. Now that's become a seasonal influenza virus. So it's coming back every year. So we're going to probably find the same thing this time as well. Now, in looking at what the WHO has given us, they're predicting about 2/3 of the global population is going to be infected. So more than likely, a lot of people that you personally know, they probably have the infection. It's impossible to kind of predict or even suggest. There I go again with my cough. That's because I'm talking a lot and it's dry in my house. It's hard to predict right now at this time. The predictions for H1N1 back in 2009 were much higher than what actually happened. So once again, if people are saying 2/3 are going to be infected, some numbers go to 40 to 70% of the world is going to be infected. If it's anything like H1N1 in 2009, it may end up being a lot less. So where is all this fear coming from? Well, I think, I don't know exactly the quote. I think it was Reagan who said this, but, let's take advantage of every crisis. I mean, you can't let a crisis go without taking advantage of it. And I think that's what's happening right now. For a lot of different reasons that, I'm not even going to begin to try to suggest what they are, but certainly the media and the politicians are taking advantage of this in all parts of the world. And in fact, I just saw an article today where the Revolutionary Guard of Iran is saying that this is a biological attack by the United States. I mean, it just gets insane. And so the problem with all this fear-mongering is that, and this is a statement, very clear statement by the WHO, by the WHO, which was also a problem back in 2009, is that there are too many inaccuracies and conspiracy theories that are really scaring people. I mean, there's a run on supplies. So now the people that are really challenged are the healthcare providers because they can't get the gloves, they can't get the masks. These are the guys at the front line, including myself. I mean, I just called, my supplier and says, okay, great. Can I get some masks? I mean, I knew I wasn't going to get anything, and I didn't even try last week, but they've been out for the last month and a half. And so I'm going to jump into a little bit more into, what are the symptoms? I mean, they're just your typical, symptoms of the cold. It's a fever, it's tiredness, it's a dry cough, aches, pains, nasal congestion, runny nose, sore throat, diarrhea. And most people, the prediction is that probably 80% of the people will have mild or no symptoms at all. That transmission that you have, I mean, is like typical cold. It's usually through sneezing and coughing. But here's what's important to know is that, I'll take some water here so that I don't scare you with my cough. At least I can't transmit anything if I do have something. But more than likely, we're all going to get, inoculated. We're probably going to have it, and I'm not worried about it, and I'm going to share with you in a moment why. So, we're not quite sure what incubation period we think is about 4 or 5 days, but we're not sure how long it's going to persist, afterwards. But here's what's interesting. The main mode of transmission is through air droplets, but it can survive on surfaces, and it can survive up to 9 days. So typically, I don't think it's going to last that long. I think it's more like a couple of days, certainly a couple of hours, a couple of days, maybe up to 4 or 5 days in general. But it has been shown to survive for about 9 days. And this is important information because this is going to allow you to take all the precautionary measures that you need to take. And these are simply these, and these are listed on the WHO page. I'm going to share that link with you as well so you can verify it. But you see somebody sneezing or coughing, they got the runs, just stay away from them for about a meter. Don't shake their hands. It's important that you monitor what you touch. And if you were, I'm kind of careful anyhow, but most people are just kind of not aware what they're touching. I mean, you go to common areas, handrails. Here's one, banknotes, right? Somebody hands you some change. You don't know where that banknote has been, so probably the best thing is to use as much of your own, plastic as you can versus, the banknotes. But bathrooms is a big one. Just think about windows. The subway is a big issue with the ticket thingies, whatever they call them. And that's what's cool about New York. What they're currently doing is they're cleaning out all these subway surfaces pretty much every 2 hours. So if you're in a business, if you're a business owner, for example, just monitor those surfaces where people can touch, and then go ahead and wipe that off on a regular basis. I went to the pharmacy the other day to pick up something, and I just brought my own sanitizing wipe, and I said, okay, I'm cleaning your countertop, and the girl laughed at me. But it's a time to have fun with this in a way, but just be smart. I was going to show you the Wuhan shake, coming out from Wuhan. A lot of people are now coming up with these crazy ideas because they don't want to do the handshake. I don't think this is going to work anymore. But the Wuhan foot shake is you just tap your feet against the other person. But other people are doing the elbows. Probably not do that. And then one of my favorites, and a good buddy of mine probably loves this one too, and that's the butt bump. So again, no problems with just not shaking hands. It's I saw this piece on the news yesterday that Merkel from Germany didn't get the memo that you shouldn't be shaking hands, and she was trying to shake her hands with everyone. She got the memo right away. So taking the proper precautions in advance is really smart. Now here's the thing: you're likely to get some symptoms because they're the common cold. You've had them before, and once again, you're going to have them again. So when does it become a problem? Well, if your fevers aren't going down, if you're having some respiratory issues, if you have severe weakness, well, let's say moderate weakness or significant weakness, then maybe it's a good thing to call your doctor. But certainly if you have any kinds of symptoms, maybe it's just a thing to stay at home. Interesting enough, in Seattle, they got the recommendation for people, for 2.2 million people just to work out of home. And that's maybe not such a bad thing. So the importance with all this is being smart. If you have symptoms, stay at home. If you see somebody with symptoms, just kind of, respectfully say, okay, great, nothing against you, but I'm just taking my precautionary measures, nothing to feel guilty about. Here's the other thing too, and I heard this from another friend of mine, is don't make fun and don't be judgmental of other people that are taking the precautions. Okay, some people wear the mask. I don't think the mask is going to do much. That's pretty much the statement that's out there. The N95 mask is that mask that you do want. But I think it's really important to have that kind of mask if you're in the public health and you're really in close contact. As medical professionals, we have to be in close contact with people, and so our risk is the highest. Your risk isn't there. It's probably not going to really benefit you anyhow because you're not going to come into that kind of close contact. It's a matter of proximity. Proximity here is an issue, and that's why don't get those masks. And this is straight from the CDC, the chief of CDC saying, look, let this be available for the medical professionals because they're the ones taking care of you if you get sick, and so we need to make sure that we get to take care of them. So important to realize too that if you come in contact with anybody that's been abroad, or you've been abroad, particularly in those epidemic areas of South Korea and Italy and China, and I guess Iran as well, and you've got any kind of symptoms, then best thing is just go ahead and contact your own doctor. But here's the thing: when you do contact your doctor, in all fairness to them, you got to make sure that you let them know what's the reason, and give them some information as to what's going on with you, so that they can give you the right kinds of recommendation at the time. And I can see my video just got lost here, so I'm not sure what's going on with that. So again, it's so I don't see anything on my what's on YouTube. but I don't see it on Facebook anymore. So I'm wondering what's been happening with that. Maybe it's my computer, but none of the Facebook ones are on. So hopefully nobody shut me down for any reason, because this is not a political thing. This is just trying to help people understand the facts, and I'm going to support all this, with what the CDC shares, what the WHO shares, and all that as well. If I am being shut down, it's kind of interesting. It's kind of fun. So banknotes, door handles, office kitchens, ATMs, guardrails, communal bathrooms, hospital surfaces, phones, and airplane seats. So you know what? There are a lot of travel advisories out there. Just pay attention to that. I know United Airlines is dropping the number of flights that they're going out because there's a lot of travel restrictions out there, and so that's going to be a problem. But just carry some of those wipes. So to help you avoid getting infected, wash your hands regularly. So besides watching what you touch, wash your hands regularly. And the key here is at least 20 seconds. Another key is you can use some antiseptic soap. It's kind of questionable, how beneficial that's really going to be and how important that is. But certainly just using soap and water is going to be enough. And this is straight from the CDC. Another fact that's kind of interesting is to appreciate that there are studies that show that wiping your hands dry with the paper towels is actually the cleanest way, and the other ways are not. Even using those drying machines, they're not really that as effective as using paper towels. So what are the other things that you need to know? If you are sick, like I said, make sure that you talk to your doctor. The challenge nowadays is that getting supplies for the testing. So at first the testing was limited. A lot of independent people have sought to arrange the testing, and so the idea is that with the $8 billion of government funding, which is awesome, it started off at 2.5, and I think people realize that we need a lot more. Working very closely with healthcare facilities, as well as the medical manufacturers and suppliers, to make sure that the supplies are available and the production is quickly ramped up so that people have access to that. And so this includes the testing, obviously, working on a vaccine. When we look back at H1N1 virus, the first case was back in 2000. It was in April 2009, and they didn't have an effective vaccine till about November 2009. And so that vaccine is not going to be here for a while. Interesting enough, the H1N1 virus hung around for 1.5 years. So this is not something that's going to go away in a month or two. We have to be prepared for that. It's going to be here for a long time. And so for all those people who went out to buy food and supplies, and I know I talked to a buddy of mine in Australia, and all the supermarket shelves were empty, there's no reason to get that fearful of that. Interesting enough, what's going to be a problem with the transportation issues is that sometimes those supply chains are going to get limited as well. And so that's something that we have to be cognizant about. And that is, are these supply chains going to be effective enough? I think in the United States it's probably going to be okay, but in other countries it might not be okay because of all the travel restrictions. So yes, being mindful of what you might need. My guess is it's not going to be that severe. I think what will be severe is the behavior of people in these areas, and so you're going to have to be really mindful. With all the tensions and anxiety happening, I'd be more fearful of that than anything else. And so, fortunately, I grow some of my own food. Fortunately, I need to lose about 20 pounds. So, and I keep on buying stuff over months, and so I got a pretty good stockpile. So I'm going to be fine, and hopefully you will too. the point of the matter is this is going to last. I mean, this is going to be around for another year, and so please don't freak out. Here's a fact. This is what we know, is that out of the perhaps 100,000 people that we know that are infected, and that's the known number. Clearly, there's a lot more than that. But of that known number, the facts are very demonstrative. And what's important to know is that I don't think there's a single person under the age of 30 that's infected, which is different than H1N1, where a lot of kids that were younger kids at the age of 5, and older people were also more affected. But yeah, so with this one, the median age of somebody being infected is 61. The median age, and this is reliable information with what we know so far, of the fatalities is 81. And so who's at risk? Well, it's the elderly, of course, but it's also the immunocompromised. So technically people with either heart disease, lung disease, asthma, other immunocompromised situations, high blood pressure, diabetes, smokers, highly polluted areas, yeah, you're probably at more risk for that. So especially for the elderly, it's important just to basically, probably what you like to do anyhow, is just avoid people. And if you have elderly in your family, then I think it's also important to make sure that people are taken care of. And so whilst I'm still on YouTube, it looks like I'm no longer live on Facebook. So I find that really, well, when is live? Yeah, I think I'm still live on my business pages, but not on my personal page. I find that highly fascinating. Yeah, I'm cancel out on my private page. Uh-oh. Well, that might just be a fluke, and I'm totally okay with that. The people most at risk are the elderly. And so what's cool about what the CDC and the government is actually currently doing is they're heightening the surveillance in nursing homes, because clearly these people are at the highest risks. And so they're making sure that their protocols and their standards are the highest, so that these people are also, taken care of. They're also stating that anybody can get tested if they want to. All you have to do is go to your doctor, and patients who get the order by the doctor, then they should get tested. The WHO, like I mentioned, has come up with a couple of statements. Their first priority is to handle the pandemic. My own prediction is that it's really not going to be as bad as we predict it to be. And it's just unfortunate that there's a lot of fear-mongering on many different levels and from many different places. And their second thing is to handle what they call the infodemic. And, there's a really neat statement. Let me see. I have it here. No, that's a different statement. That's for the next part. But I think a lot of people, unfortunately, are taking advantage of this and scaring people of whatever motivation and agenda they have. I don't know. But just as an example, looking at Hong Kong, a lot of the domestic workers, and many of them are migrant workers, are suddenly out of a job. And which is unfortunate, because now they have nowhere to go. They're living on the streets. They can't go back home because the restricted airlines. And so all these poor souls, there's about 400,000 of them in Hong Kong, are now really struggling, and they're not being paid and all that kind of stuff. These are really, really unfortunate things. Just to know that the situation in China, interesting enough, and it's hard to tell this information, but one thing that seems relevant is that they were able to quickly isolate what's going on, and they have actually cities that complete lockdown. And I think the estimated number as of a few days ago was 760 million people are affected by these lockdowns. And so they have this ability to really kind of figure out what's going on, where it's going, and what to do about it. Interesting enough, here's another trivia from NASA. NASA obviously takes their pictures, and they've noticed a huge change in the pollution of China. It's remarkably reduced. So if there's any benefit from that, then that's the benefit. So I'm at the bottom of the hour, and I'm going to kind of wrap it up on this part, and just appreciate some of the things that are important here. Is that a lot of people are going to get infected. It's something that, just be smart. Eat well, sleep well, don't drop your immune system down, don't overdo things, don't stress yourself out too much. Take your vitamins. Vitamin C is probably a good thing. There's other vitamins like vitamin D3, and I'm not giving any recommendations, by the way, but you can check it on online and kind of decide for yourself, what kind of vitamins would help you. And take smart measures. I mean, you don't need a mask. You're not going to get one anyhow, and if you're going to wear one, it's probably not going to help. I think, if anything, if you have the sniffles and you're going out, then maybe wear one so that it's going to catch most of it, and you can, maybe cough in it too. But if you're still going to cough, in your elbow there to really, really minimize things. If you do get symptoms, just monitor carefully. Limit your getting out of the house to stay at home. For the most part, if you don't have a fever, more than likely, you don't have COVID-19, and I think that's relevant. So no need to freak out. Just be really appreciative and understanding of how other people are. They're freaking out. The tempers are going to be rising. Again, it's going to come down to the common cold. Most people will not be infected or affected by it. We're probably not going to get 2/3 of the world infected. It's probably going to be a lot less. But we've had these things before. And there's an interesting statistic here. 1.25 million people die per year from car accidents. That means 3,287 per day. There's a prediction of 600,000 people dying of cancer this year in the United States. So we can put all of this in perspective. And the most important thing is, get the facts. If you don't know the facts, don't rely on some pundit who's fear-mongering you and telling you that you're going to die if you don't do this or that. Be smart. I think certain places are challenging, and so I certainly avoid those. I know there's a lot of homeless people in certain parts of the country. I'm not going to mention which, but you know which ones. And you know what? That's a recipe for major, plague proportions. And so it's important to be very mindful of that. So next thing is about regenerative medicine. I'm very passionate about regenerative medicine, and I want to make not a disclaimer, but a very clear statement with that. Is that I've always operated out of the highest integrity and making sure that I'm consistently doing the right thing, and I'm the guy that likes to follow the rules. In this particular case, it's the FDA. Like it, dislike it, agree with it, disagree with it, understand it, or don't understand it. It really doesn't matter. They're the cops of the country, the medical cops of this country, defining, what's safe. Their job is a tough job, and you can say what you want about them. They're in cahoots with the companies or not. I don't know. I don't know that fact. But the fact of the matter is that we had this terrible disaster many, many years ago. You all know of it, the thalidomide disaster, and now they're extremely cautious in making sure that we do the right thing. Because of that, things take a while for them to happen. And that's unfortunate, because as a medical professional, sometimes I'm frustrated because I want to do things that I just can't do. And so with that in mind, the FDA has made it very clear. It hasn't approved regenerative medicine products in this country. And I'm using that name specifically because the name stem cells is no longer appropriate. It's very misleading, and it's not going to help you understand what this is really all about. But to get back to the FDA, what's important is that, we they very specifically have said this, is that whilst it's not approved, it's also that people can't make claims. No one, and I'm not going to make any claims. And if I make a claim this time, it's a mistake, and ignore it. Okay, and nor can we use testimonials, because, as they say, there's a lot of bad actors out there, and that was a comment that I wanted to bring up from the FDA. Let me see if I can find it. But there's a lot of bad actors out there, and because of that, they're preying on the vulnerable. And here's this great comment from the FDA Commissioner Scott Gottlieb last year. He issued a statement, ... Dishonest actors exploit the sincere reports of the significant clinical potential of properly developed products as a way of deceiving patients and preying on the optimisms of patients facing bad illnesses. And he's absolutely correct. And it's a madhouse out there. I've seen it. It's ridiculous. It's insane. People are making these claims, promising people that they're going to be cured, and collecting all their money in the number of thousands. We're talking $20,000, $30,000, and getting absolute no results. And it's really, really unfortunate. The reason I'm bringing it up here with the coronavirus, besides the fact that I'm very passionate about regenerative medicine, and I've been in that field for the last 10 years, and as I mentioned earlier on, my focus, because of my training, I grew up in 5 different countries, speak 4 different languages, studied at top universities in Europe and in the U.S. I can't say it's a unique, but I don't know many people have this perspective, and that is, I'm bringing everything together. I'm bringing the brain intelligence, the body intelligence, and the energy intelligence in all the work that I do. And so this allows me to navigate through all those other areas that many of my professionals, just ignore, discount, deny that even exists, and are very critical of. I have a lot of arrows in the back of my back because of that. Just the mental aspect is really huge. Just that energy aspect, the metaphysical approach is huge. And so it's a lot of fun for me to talk to all these different people that can help you change your life. But the biology is also an important one, and we can't skip out on that. And so my focus has always been, how do we get access? How do we harness the potential of the body to restore form and function? And so looking for this for years, dove into functional medicine way before the name even existed, but realized at that time that the science hadn't caught up. We didn't have the tests, we didn't have the know-how, we didn't know what all the nutrients that we needed, and there was this thing called the microbiome, which we didn't even know then. And so fast forward comes this technology that was made available to me in about 2009, in fact, that processed the adipose tissue, so your fat tissue, and can get high quality numbers of MSCs, and these are mesenchymal stromal cells. And I'm going to use that word stromal cells because it's really important, because they're not technically stem cells, and I'm going to explain that in a moment. And so I was fortunate enough to be able to practice with that, particularly in cosmetic surgery and some reconstructive surgery, for a couple of years, until the FDA really restricted that. They realized that we needed to have more clinical evidence on that. Up to that point, we had very little clinical evidence. We had a lot of laboratory evidence that was clearly suggesting what the benefits could be. Let me rephrase that. There's a lot of laboratory evidence that was suggesting the potential, and that's a rephrase of what I'm saying, the potential of what this could do. Because in the laboratory, which is interesting, they use a lot of animal studies. In the laboratory, what you can do is you can find out specific situations, mock-up situations where you inoculate a mouse, let's say with an adenocarcinoma, and then you give it cells, the MSC cells, I'm going to use that term, MSC cells, and then you can see that the mouse survives and the cancer goes away. And I'm going to list these studies out there. You can verify their value for yourself. Particularly with pneumonia is one. There's another mouse study And I'm sure they have all these proper procedures for animal stuff. But what's important is that there's one study where they look at the pneumonia model in mice, and what happens with pneumonia, which is consistent with, say, the influenza virus. And this particular one was the H5N1 influenza virus that they studied. I'm going to list it in a moment or later on so you can look it up. And it's a open source article, so you don't have to pay for it. Where it reduced the amount of fluid that collected in the lungs, and then the respiratory problems resolved, and the mouse survived. So imagine that. So what I'm getting at is that with me in the field of regenerative medicine, starting in 2009, doing it for a couple of years, and realizing that we didn't have all the clinical evidence to make sure it was, number one, safe, and number two, that they could deliver the results that people were stating, the FDA pretty much shut it all down. Totally respect that. For me, what was important in the work that I was doing then to justify why I was doing it is that I had seen enough clinical evidence that, laboratory evidence, that the cells, the MSC cells taken out of your own body were safe. For me, that was an important factor. For me, it was your own cells. We're taking your own cells out and giving your own cells back. The only issue was, we would give an enzyme to separate those cells, and the question was that enzyme safe? And what I had seen that it was. And so, as long as we couldn't do it in the United States, I was very fortunate to hook up with the group that introduced me to this technology at first, and then we went over to the Bahamas. And so did tremendous work there. I'm not going to state any claims about the people that we treated and how they did, but I was happy that I was able to do that for them. Why is this relevant now? Well, the relevance is this, is that we have a virus that doesn't have a cure. There are antiviral agents out there that we use for H1N1. I forget the names of what they are. I don't know if they're being applied here. And so when this study comes out, and I'm reading it verbatim from the website, the patient had been fighting for life in the intensive care unit at the Baoshan Hospital in Kunming, the capital of Southwest China, Yunnan province, for nearly 2 weeks after contracting COVID-19. And then finding out that she made a startling recovery. She's 65 years old and made a startling recovery. I don't know exactly how long it took. There's currently, if you go to the clinicaltrials.gov, you'll see that there are currently several trials out there. I'm guessing that they're all in China. And so they're looking at specifically umbilical cord stem cells. So it's not the correct term, by the way. It should be umbilical cord MSC cells. And let me explain it a little bit. And I only have about 10 minutes left. So MSCs, the mesenchymal stromal cells, so they're a derivative of a stem cell. So what's happening is that we're able to acquire MSC cells, which are stromal cells. They're not the stem cells. They're the stromal cells that came from the stem cell, that from the umbilical cord tissue. Now what's cool is that these stem cells, they have what's called a niche. It's a little pocket in the tissue, and that when the cell it can differentiate. No, let me rephrase that. The stem cell, the real stem cell, can divide. So it either divides into a new stem cell, or that divides into what's called a progenitor cell. But here's what happens. It only becomes a progenitor cell when that cell, that stem cell that divided into another stem cell, gets bumped out of that niche. So it's got this protective environment that keeps the stem cell in place, and once it gets bumped out, it becomes a progenitor cell. And that cell, which is the MSC cell, then has a very specific lineage. So it can become certain different types of cells. It could be a muscular cell, it could be a fibroblast, and so or cartilage. And when we have it from, let's say, adipose tissue. And so it's important to realize that we're not actually dealing with stem cells. We're dealing with MSCs. And so the terminology that's appropriate today is cell therapy or regenerative cell medicine, because that's what we're dealing with. And these are cells that have a very limited potential to differentiate into different cells. Now, what's cool about umbilical cord is that they have a much greater proliferative ability, which means they can duplicate a lot more than your own cells. So people have gotten bone marrow cells, and we've been treating leukemias and things like that with that. People have used the adipose derived for different kinds of conditions, and I'm not going to name them. And then others have used the bone marrow cells for orthopedic cases. So I have another clinical study that was done, and I'm going to list that one too. I don't have it right in front of me, where limited number, and there are a limited number of clinical studies out there, which is the problem. Many of them are not blinded, which is also a problem. Kind of hard to do them blinded, by the way, in this kind of setting. But there's one particular study, as I mentioned, I'll quote it on the links, where they took out bone marrow and the rotator cuff, that's your shoulder. I think it was in 1918 or somewhere around then, they did the first type of repair. And since then, there hasn't been much improvement in the quality of the repair. So they actually took some bone marrow, got the cells out, the MSCs out, and there was a significant improvement in the repair of the rotator cuff, because one of the challenges of that injury is the poor blood supply, and these regenerative cells are able to modify that. So the science is showing and suggesting that these kinds of cells, by releasing different factors, and that's what's called the paracrine factor. The paracrine factor are the products that they deliver to the tissue that then are able to help with inflammation. It can help with the immune response. Can help with blood cells growing or blood vessels growing. Can help with combating the bacteria and viruses. And so by the release of all these different chemicals or products or molecules, science in the laboratory is clearly showing that there's an improvement of the situation. And again, I'm going to share some of those things. So the important thing about regenerative medicine, I'm going to read this quote, is the commissioners in this area say in the report that regenerative medicine aims to replace or repair human cells or regenerate tissue or organs to restore form and function, or normal function. The form and function is mine. The emphasis on normal function sets this approach to medical treatments apart from many commonly used drugs, which tend to treat symptoms but do not address the underlying causes. So these are official statements out there. They're not making claims. They're relating to, what's the possibility in regenerative medicine? Cell therapies and regenerative medicine, with their potential, remember potential, not a claim, to improve the health of patients, represents a structural shift in healthcare by focusing on the underlying cause of disease by repairing, replacing, or regenerating damaged cells in the body. And then, according to the report in The Lancet, the potential exists to substantially reduce the burden of disease for some common conditions like stroke, heart disease, progressive neurological conditions, autoimmune diseases, and everything else. The onus is on all of us medical professionals to take into account two things. We need clinical science to show that it works. It needs to be well regulated. This whole process needs to be well regulated by the FDA. In collaboration with them. It makes no sense to bypass them, fly under the radar, because invariably, everybody is going to be caught. Besides that, if you're trying to fly under the radar, then more than likely you're not doing it with integrity, and more than likely you're not being honest with your patients. I'm very bold in that statement, and it has to be that way. We've got to be responsible, because if we're not and people have problems, the FDA is going to come even harder on us, and it's going to take us even longer to be able to provide this to our patients. And I think that's a really important thing. As a whole, we really need to rely on the proper kind of science to help us navigate this in the best possible way. So, when science is showing to us that there are benefits and there's the potential. Let me rephrase it. I'm being really careful here. The laboratory science, is showing that it can affect the survival of viruses. I think that's important. In the mouse study that I mentioned, as it relates to the influenza and pneumonia, what happens is that there's so much inflammation that occurs, in the lungs. There's a lot of fluid that occurs, and there's a specific process by removing that fluid. And this is where the mesenchymal stem cells have shown benefit by the release of different products to reduce the amount of fluid that gets collected in there. So regenerative medicine is exciting. I think there's opportunities. There is that question in today's situation with the coronavirus, is there a role for using this, at this time? I think the bottom line is that if it's not something that you would want to do if you don't have symptoms. I'm not saying that you should do it if you have symptoms. I'm just saying that you have to have a good conversation with your doctors and figure out, what's the smartest thing that you can do for yourself. The most important thing for all of us is really to be very cautious in our lifestyles and our behaviors, what we do, who we come in contact with. But more importantly, be very cautious as to what we're telling people. We have to be cautious in what we hear. Stand guard to the door of your brain. I think that was from Jim Rohn that Tony Robbins keeps on repeating. It's important to verify the information that's out there. It's also important to plan. Make sure that you get to take care of yourself. Interesting enough, I got a little girl, and she was in Nashville, and one street away from her hit the tornado. Now, fortunately, I've been telling her, you've got to be prepared for eventualities. You've got to make sure that you're safe and all these things. And so, fortunately, she had done the right things, and so she's okay. But that's the scary thing. I mean, that tornado could have been like 500. It's really important for us to allow the public health systems to do their job. We can't drown them in all this fuss. The sad thing in all of this, I think, is that a lot of businesses are going to suffer tremendously. The ones that are on the fringe of collapse, they're definitely going to collapse. Economically, I've been told by Morgan Stanley that this is just going to be a blip on the economy, so don't worry about your stocks and everything else. But again, I think it's imperative that we keep our heads on. We pay attention to what the government is telling us. We have problems, go check with your doctor, and just have smart and nice behavior to other people. Just be good to other people. And I think that's about all I want to say today. So I want to thank you. Unfortunately, it didn't make it on my private page. Not sure why, but it made it on my business pages. Prescription for Your Transformation, as well as my local wellness director. It's a cool thing that I'm coming out with. And I'm also coming out with a cool program to help practitioners in the United States to get it right in regenerative medicine. Yep, that's what I'm doing. That's my claim right now. I'm going to come out next month. Yeah, next month it's coming out to really help and support all these amazing doctors who want to make a difference, but how to do it with integrity. So I'm Dr. Bart Rademaker, and this is Prescription for Your Transformation. Real people, me, Robin, thank you again. You've been quiet as a mouse.
Let me talk, Doc.
Right. Prescription for Your Transformation, real people, real conversations with myself today, and real success. Tapping into your authentic genius and really tapping into our brain intelligence, our body intelligence, and our energy intelligence. Stay safe.
It's time for Dr. Rademaker's Prescription for Transformation. Let's tap into your own authentic genius and live the life you desire.
You are now listening to
Join Dr. Rademaker for an